Therapy techniques, person-centered techniques for use with high functioning, for use with situational disorders, or involving self-esteem, confidence, and help in goal setting. Techniques include acceptance, unconditional positive regard, empathy, reflection, support, clarification, open-ended, modeling, rapport building. Behavioral therapy targets dysfunctional behaviors, works by altering actions. If the simulation describes symptoms in terms of behaviors, use behavioral. For use with low to moderate functioning, including eating, conduct disorder, substance, impulse, conflict, phobias, sexual, suicidal, relapse, some sleep. When used with cognitive, helpful for depression, anxiety, and early personality. Techniques for behavioral therapy include baseline, contracts, diaries, aversion, consequences, reinforcement schedules, incompatible alternatives, flooding, in vivo, biofeedback, relaxation, role play, modeling, assertiveness, token, activity schedule. Tracking improvement monitoring, self-report, review of data, compliance with treatment, appointments, referrals, lessening of symptoms, improvement of functioning, affective and cognitive, assessing information from other treatment providers, medications, social interactions, energy level, mood graph, cognitive dysfunction. When symptoms are described in terms of cognitive dysfunction, the need for a cognitive technique is indicated. Rational emotive therapy. Useful for the treatment of depression, anxiety, mild situational disorders, and bulimia. Cognitive techniques are contraindicated when family has a history of bipolar, schizophrenia, cognitive disorder, or mental retardation. Cognitive techniques. Analysis of dysfunctional thinking patterns, cognitive restructuring, hypothesis testing, mental emotional imagery, modeling, thought stopping, meditation, self-talk, record of dysfunctional thoughts, diaries, letter writing, rating systems, hourly mood graph, affirmations, systematic assessment of alternatives, grid evaluations. Existential psychotherapy, goal of changing meaning, indicated for high functioning individuals, particularly those with a V code. Those with mild to moderate depression or anxiety, help coping with life-threatening illnesses, situational concerns, seeking meaning in life, not for substance abuse, Gestalt counseling, used in combination with cognitive and behavioral approaches, indicated for moderate to higher functioning individuals, good for those with somatic complaints, provides access to feelings with the goal of unblocking. Gestalt often targets anger, grief, anxiety, and depression. Adlerian psychotherapy, lifestyle results from private logic, indicated for those with issues of goals and directions, parent-child problems, acting out behaviors, career crises, marital concerns, or low self-confidence, focuses on healthy or unhealthy coping skills. Prolonged psychoanalysis, indicated for those with hysteric or phobic disorders, contraindicated for those with paranoia, borderline personality disorder, obesity problems, psychodynamic psychotherapy for high-functioning individuals with disorders, personality disorders, multiple personality disorder. Short-term can be beneficial for depression, anxiety, and situational disorders with repeated patterns. Adjustment disorders, objectives, symptom relief, improvement of coping skills, and restoration to at least prior functioning. Anxiety disorders, objectives, reduction of anxiety, improved management of stress, development of socialization skills, sense of mastery. Generalized anxiety disorder, anxiety management program, computer-based training, relaxation, antidepressants or azapirones may be indicated but not recommend pharmacological interventions. Panic disorder, panic control treatment, computer-based training, relaxation, bibliotherapy, panic education. Antidepressants may help, do not recommend medications. Obsessive compulsive disorder, exposure therapy, anxiety management training, cognitive processing, antidepressants may be indicated. Mood disorders, objective, overall adjustment, mood stabilization, alleviation of depression and mania, enhancement of coping skills, improvement of relationships and relapse, and relationships and prevention of relapse. Disorders of behavior and impulse control, including eating disorders, sexual disorders, sleep disorders, psychoactive substance use, and other impulse control disorders. Objective, reduction of dysfunctional behavior and acquisition of positive behaviors, behavior change. Emphasis on behavior therapy with a multifaceted approach. Behavior and impulse control techniques include education, measurement of changes, improved communication. Group work can be helpful for those who are resistant to therapy. Medical examination is important in the evaluation. Anorexia and bulimia. Medical assistance and nutritional counseling may be combined with family therapy for significant change to occur. Hospitalization may be required. Anorexia and bulimia techniques. Behavioral approaches to stabilize eating patterns. Insight-oriented psychotherapy follows stabilization. Anorexia, more serious because psychotic features may be present. Bulimia, insight-oriented focus on body image, self-esteem, and behavioral therapy. Hospitalization can be handled on an outpatient basis. Interpersonal therapy, therapy groups, and computer-based training and behavioral weight loss are appropriate. Sleep disorders. Insomnia, stimulus control therapy, sleep restriction therapy, relaxation training, cognitive behavioral therapy, benzodiazepines, zolpidem, and antidepressants may be effective. Do not recommend medication. Disorders combining physical and psychological features. Objectives: reduce somatization, constructive expression of feelings, stress management, improve socialization, relaxation, positive use of leisure time, personality disorders. Objectives: improvement in social and occupational functioning, increased communication skills, raised self-esteem, enhancement of coping skills, developing a sense of responsibility, long-term modification of underlying dysfunctional personality patterns, disorder involving loss of contact with reality. Objective: restoration of contact with reality, enhancement of coping mechanism, maximizing adjustment to the disorder, relapse prevention, providing assistance to family members, working through appropriate care-related decisions. So I'm going to give you time to look over this, see how much of it you can memorize, pause the video, read over it, and see how much you can plant into your long-term memory. Okay, I'm sure you've had time to look over this and memorize it. This is what you should do for all the disorders included within this video. Just take time to read it and put as much of it into your long-term memory. Next disorder is schizophrenia. Techniques for schizophrenia include behavioral therapy, social learning programs, family education, and social skills training. Vocational rehabilitation. Antipsychotics may be helpful. Do not recommend medications. Sexual disorders. Must rule out underlying mental health conditions such as anxiety disorder or depression. Biochemical or medication-induced explanations should be explored. Treatment of children. Two methods are considered effective: insight-oriented approaches and behavior-based approaches. Insight for children. Focus on feelings within experiences. Play therapy. Adlerian therapy, behavior for children. Rewards, consequences, reinforcement, behavior modification, treatment of adolescents. 3 techniques are considered the most useful: reality therapy, peer control groups, social skill training. In reality therapy, use of contracts and success failure identity concepts may provide helpful therapeutic considerations. Attention deficit hyperactivity disorder. Objective: increasing child's ability to learn and manage impulses. Oppositional defiant disorder and conduct disorder. Primary treatment setting will most likely be a residential treatment program, day program, or combined school and community facility. Elimination disorders. Focus on symptom through behavioral approaches. Dry bed techniques. Modalities exist. For purposes of the exam, there's only 3 modalities, which is individual, family, and group. Determine what a client's most important need is and use the technique and modality that best fits that need. Individual therapy. Recommended for clients who have little connection with others, withdrawn, highly anxious, or introverted. If the client is suspicious, antisocial, hostile, or destructive, individual therapy is better than group work. Those who do not deal with ambiguity well, those looking for independence and individualization, difficulties with intimacy are indicated for individuals. Group therapy. Clients who need reality testing and group feedback. Recommended for those who may feel stigmatized, scapegoated by individual therapy. For interpersonal behavior concerns, anxious clients who experience authority concerns benefit, as well as those who give the therapist excessive power. Family therapy. For families with severe pathology but experiencing communication difficulties within the family structure, when intergenerational conflict arises when more than one family member needs help. And that is an overview of some of the counseling techniques. Please feel free to subscribe and comment below, and thanks for watching.